Okay, let's come and sit down. Okay.
We have a full house today, that's for sure.
Yeah. I don't know what the interest here is, but
I think it's just the biggest committee room. We're the only committee going right now.
yeah. The new car, that's Linda's. I drove it yesterday. Good morning. Today is August 23rd. The time is 3 minutes past 9. The Insurance Committee of the Tennessee House of Representatives of the 113 General Assembly Special Session is now in session. Clerk, please call the roll.
Representatives Capley, Sapicki, Davis, Freeman, Hilton Haynes, Himmer, Hicks, Hill, Johnson of Montgomery, Johnson of Knox, Lafferty, Mitchell, Ritchie, Rudd, Rudder, Sparks, Terry, Thompson, Vice Chairman Martin, Chairman Kumar.
Here.
Mr. Chairman, you have a quorum.
Thank you. In personal orders, I'll take the privilege of welcoming Chairman Timothy Hill to the committee. Thank you for joining us. Personal orders, Representative.
Yeah. Thank you, Mr. Chairman. I'd like to welcome my sister-in-law, Lori Himmer. She's in the audience today. Wave to us.
Any other personal orders? Seeing none, we will go on to handle one bill that is on our calendar today, House Bill 7032 by Speaker Sexton, presented by Chairman Ryan Williams. Do I have a motion? We have a motion. Do I have a second? We have a second.
Thank you, Chairman. I think I have an amendment, drafting code 9530.
Chairman Williams, you're recognized. Yes, we have amendment 9530. We have a motion and second to attach the amendment to House Bill 7032. All those in favor, please say aye. Opposed? None. Amendment goes on the bill. Chairman Williams, you're recognized.
Thank you, Chairman and members. This bill as amended would allow for a floor to be set as it relates to reimbursement rates, which in regards to mental health care services, both inpatient and outpatient services. As many of you may know across the state, there's an extreme shortage in mental health services across the state. We, the speaker and I, and many in the space feel like that a lot of that has to do with one's not able to provide for their family or run a business based upon the reimbursement rates that are currently being provided. So what ends up happening is in a lot of cases, the room is full or the inn is full as it relates particularly to outpatient services. What this bill would do would allow for higher reimbursement rates in that space and allow for the compensation of costs associated with that business, allowing for a more competitive market for people to be able to provide these services to more Tennesseans across the state. As you may know, being able to find an inpatient bed in Tennessee is one of the hardest things to do right now. And we have people sitting in ERs for 4 to 6 days sometimes before they can find a place. By raising reimbursement rates, it's our hope that not only would more people be providing these services, but it would open up more beds, but those that are currently have needs would be able to meet those. With that, Chairman and members, I'm happy to answer any questions you might have.
Thank you, Chairman Williams. You know, good legislation is legislation that tackles and solves a difficult problem. This definitely does that, and we compliment you for bringing it. Members, do you have questions? Representative Ritchie.
Thank you, Chairman. Thank you, sponsor. Great piece of legislation. I do have some extremely valid concerns that after speaking to the legislative individual that come down to the office was not able to give me the answers. And that's one of the concerns that I have during these special sessions and during these extremely compacted where we can't get all the numbers and data and we're supposed to vote on something that we don't even have the figures on.
Right.
So the questions that I've got, you mentioned that we already have a shortage of providers that are out there. In my opinion, this is going to exacerbate that problem by having more folks that are going to be seeking these services. Not saying that's valid enough reason not to do this. The primary concern that I have is the cost that's going to end up being passed on. So I'll ask the question, where is this going to be funded from? And the response that I received was there's $100 million sitting in TennCare in reserves. And that's how it's going to be funded. I said, so that right there is telling me that this is going to be an increase to the taxpayer. He said, no, it's not going to be an increase to the taxpayer. It's going to be coming out of the reserves. Well, those dollars came from somewhere. So that's one concern that I've got. Then when it comes to private insurance companies, those costs are going to be passed on to the end user, whether it's small business owners that are right there in my district or people that are self-insured that are there. And I'm curious, what's that cost? And we don't have that. I haven't been shared what that answer is. And those are my two big primary concerns that I've got with this legislation right now.
Chairman Williams.
Thank you, Chairman. Thank you, Representative Ritchie. To answer your first question as it relates to the TennCare costs, as you, I don't know what the exact number is today, but obviously we have just under $1 billion in reserves, cash reserves. Those are over collected reserves or unutilized federal and state dollars that are currently in TennCare. When the legislative director for the Speaker's office communicated with you, what he's saying is there would be no new costs associated with that because we're using funds we already have on hand. In addition, as you well know, because Tennessee is the only block grant state in the state, there are additional monies that we received back in December, totaling $330 million for shared savings that we have, that we can utilize those dollars as well to expand services, because that's the agreement we made with the federal government. Though we haven't determined yet where those monies would be utilized, it's our hope that a combination of those monies is where we'd be able to fund these programs, or as far as the offset of TennCare Medicaid reimbursements. As it relates to private insurance, you're right. I don't know the actual cost or the impact of what this would be, which we're waiting to get that from fiscal review. The big challenge that we have as it relates to Medicare, Medicaid, private insurance reimbursement rates, as I shared with Representative Davis earlier, you two may be in private practice in the mental health space today. Okay, you have your own private practices. You have the ability to negotiate reimbursement rates with private insurance, TennCare individually. But the representative sitting behind from you, who is a really good friend of mine, he may own a corporation that has thousands of employees that provides the same services. His staff has a better ability to negotiate a higher rate. But your rates, Representative Davis rates, and your colleague behind you, all of your rates are preserved. No one knows what they are. So it's hard for me to know what the impact of costs would be because those are preserved in their contracts. They're secretive. And so the reason for this bill is to try to be able to find, by feeling around in the dark sometimes as it relates to cost, how to be able to increase those services. So things don't happen like they did in my district, where I had a mental health care provider that provided inpatient services in my community at my regional hospital. And those beds were full because there was a great need, but they couldn't make enough money in reimbursements to keep the doors open and fully staffed. And we had someone who had an incident because it wasn't fully staffed. And so they ended up closing. There are people that want to go into the space. There are multiple entities across the United States that would come here, but the problem is we don't reimburse it at a rate in which they can even keep the lights on.
Representative Ritchie.
Thank you, Chairman. So, and I agree with what you're saying there as far as for the concern and the need for this legislation. I'm on board with that. What I'm not comfortable with is writing a blank check to the taxpayers that we don't know what it's actually going to be. I think it would be more prudent for our districts and for Tennesseans to actually know what those numbers are versus pushing something through, and the answer that I'm receiving is we don't know what that's going to be until we end up seeing it. That's like, just trust me. We're going to do what's best. Just trust the government. That's never worked out very well. So I'm not going to be, I would love to support this. If we bring it up in January, February, I could see myself and my district being all on board and supporting this right here. But I cannot agree with putting my taxpayers in my district on the hook for something that we don't know what that is. And the best answer that I've gotten from the individual that came to my office and just now is we'll have to see what it is because we don't have it yet. It's going through fiscal review. So thank you.
Representative Williams.
Thank you. What I guess I miscommunicated there. We're trying to calculate what those would be. It's very difficult for fiscal review to calculate what those are because they're not being there. But by the time we get to the House floor, if this bill was to proceed, I should have a better understanding of what costs would be going forward as it relates to this legislation. Because I, like you, don't want to pass a bill that we don't really know what the impact of the cost would be. But I do know what the impact of not changing would be, and that would be more and more Tennesseans across the state would not get the mental health services that they need because there's no room at the end. Thank you.
Thank you. Certainly, I think we have to note that there are costs involved in increasing reimbursement and providing additional mental health services, but the benefit and the costs are going to be borne ultimately in the long run by the taxpayers. But the societal benefits of that are very substantial, and I think we have to stand up to it and foot the bill if we have to. Chairman Hill, you recognize.
Thank you, Mr. Chairman. First, let me say it's an honor to be on your committee, surprisingly so. But to the sponsor and, of course, Speaker Sexton, I think that this legislation is much needed. I think that mental health generationally in the state of Tennessee has had to take a back seat to other concerns because resources are finite. And candidly, sponsor, as the author of the Medicaid block grant, I can't think of a better way to spend the excess, and we say excess, but it's a return back into the coffers of the state because we're more efficient than the federal government. But I can't think of a better way or a higher priority than trying to figure out a way to help people that are in the most need in an acute situation and even long term. So thank you for being willing to carry the legislation. Thanks to the Speaker for bringing it because the conversation has to be started on how we take care of the people who are in most need in a responsible and efficient way. So thank you, sponsor. Chairman Williams.
Thank you. I can agree more. You know, as a person whose family during COVID needed one of my children needed some counseling services, I had the ability to be able to provide for those. I think one of the biggest challenges we have is there's a lot of Tennesseans who don't have the ability to provide for those counseling services, and so I think it's really important that we try to create a pathway where we can get the people the help that they do need. Thank you.
Representative Hemmer, you recognize.
Thank you, Mr. Chair. Thank you, sponsor. You mentioned that the amendment sets a floor for reimbursement. Can you tell me exactly where in the bill that is? Kind of looking at it, thought it might be the section 10 around the parity with reimbursement for alcoholism and drug dependent coverage, but I wasn't sure exactly.
The first part of your question I couldn't hear. If you pulled my,
yeah, just you mentioned in your testimony about this amendment sets a floor for reimbursement, but I was unclear in the actual language of the amendment where that sets it out, and I thought it might be in section 10 in discussion about it states that provided that the coverage and reimbursement for mental health treatment must remain in parity with coverage and reimbursement for alcoholism and drug dependence coverage, but I wasn't sure.
Chairman Williams.
Thank you for restating the question. In section 3 of the bill, it talks about the reimbursement. Currently, it is suspected, as I shared with represented from East Tennessee, currently we don't really know what the reimbursement rates are, but it's statutory required that all reimbursement rates for mental health are the same as treatment for mental health disorders as it relates to substance abuse and drug dependence. It is theoretical in nature at this point that we are not reimbursing for mental health services at the same rate in which, and so that floor that I was talking about would be the treatment for alcoholism and drug dependence, which we believe in our study in history, communicating with individual providers, is actually being paid at a higher rate than what mental health services are. What this bill would do is it would ensure that they're following the federal guidelines, that those mental health reimbursement rates are in line with drug treatment. Does that make sense?
Representative Hammer.
Thank you, Mr. Chairman. Thank you, sponsor, for that explanation. And then the second question is around, 10, and I think the representative next to me mentioned this, but it was allowing TennCare to use the excess funds or savings to pay for these, but I didn't see language kind of enacting that or creating that in the legislation. Can you talk to me how that works?
Chairman Williams.
Thank you. On this committee sits the chairman of budget sub. It's a question that'll probably have to be answered in finance, because that's where we would direct through an appropriation of funds, generally speaking through appropriations bill, as to the funding once the actual fiscal note is done. So we would have to fund the utilization in language. We'd have to fund the utilization of existing funds, either in excess funds of TennCare or in cash reserves, in order to fund it. And so that's a question that's not necessarily germane to the insurance, but is germane to the finance committee.
Thank you.
Representative Hammer.
Thank you.
Chairman Spicky, you're recognized.
Thank you, Mr. Chairman and sponsor, Chairman Williams. Maybe I can answer some of these questions for you, being on this committee for a while now. In the block grant that Representative Hill ran, one of the things we gave TennCare was the flexibility in using the savings on the appropriateness of what they deem necessary, addressing the health needs of the people that are on TennCare. So if there is any extra cost involved here, TennCare already has the flexibility to use the shared savings on how they want, as long as it stays tied to TennCare. So the question that was asked about how are we going to find this money, they have the flexibility to already do this, and most of us were very happy to vote for that flexibility. Another issue here is the fiscal note that's already attached to this allows us to draw down the matching federal dollars so that we can increase the amount of people that are going to receive mental health care in Tennessee, especially those on TennCare that are the most vulnerable. So I applaud you for that also, of putting that piece in there also. And then lastly, it talks about in the bill that if you're a private insurer, the only time you're going to have to cover mental health issues is if you already provide for alcoholism and substance abuse. So in the policies that they issue, if they do not have those provisions, then they don't have to cover the mental health. But if they do, we're saying we have to provide parity across the board, that we are deeming mental health is just as important as treating alcoholism and substance abuse. So it's a very good bill. It's very well written, and I look forward to voting for this, sir. Thank you.
Chairman Williams, you're good. Representative Johnson of Knox.
Thank you, Mr. Chairman. And I would like to echo that this will ultimately pay for itself, because making sure that our citizens are mentally healthy will actually save quite a bit of money in a myriad of ways. But as far as resources being finite and things like that, we do have the ability to expand Medicaid, which would add 300,000 people to the rolls and provide them health care. We could accept that $1.4 billion from the federal government and give care to hundreds of thousands of more Tennesseans, and that includes mental health care. And money is provided to build new facilities to do all of that. So, I think that we should consider all options. I think this is helpful, definitely, but we are refusing a huge help in the state that is not going to cost us a penny. It wouldn't add a penny to the budget. But I'm curious, with the ACA, parity was passed in the ACA, so I'm curious why this bill is needed.
Chairman Williams.
A lot to unpack there. Every state that's expanded Medicaid has had to bring up additional dollars in order to pay for it over time. That's just a fact. Do your research to do that. The other question, that's not germane to this bill. Your other question, as it relates to whether or not the ACA pays for this or not pays for this, I can't speak to what the ACA's language is, but I do know that the tenets of this bill says that we want to pay on in parity with mental health and substance abuse, with mental health services and substance abuse services, that they be paid the same. That's what the bill says.
Okay.
And the reason why currently there's some concern is we feel like in our research, mine and the speaker's office, that those rates, reimbursement rates, aren't being paid at the equal rate. We can't delve into someone's contract, but we have our suspicions that that's the case. And so the hope is that we can get reimbursement rates raised by saying they have to be on par and following the federal guidelines.
So we have suspicions, and you hope this bill will do what you think it will do. So, but we're not assured of that.
Chairman Williams.
Thank you. I have suspicion because, as I stated earlier to the representative, that there is concern that the reimbursements aren't the same. Because they're preserved in contract agreements, we can't know what those are. So that's where the hope comes from. But the fact is, if we raise these parity rates, we can calculate those based upon what we know about the TennCare model for sure. And so those folks that are seeking mental health treatment in the state will be getting a higher reimbursement than they're currently getting, which, based upon what you said, is a benefit.
And the federal government requires that parity. So you're expecting that these companies are not valuing that higher law?
Chairman Williams.
As I said previously, I can't
Okay.
confirm that.
And as to the Medicaid expansion, monies were just allotted for states to get it 2 years for free with extra money for 8 years that would pay for it continually for 8 years in Tennessee. And we still have our hospital associations that are still willing to take up anything that the federal government doesn't pay for Medicaid expansion. Thank you.
Thank you for your comments not related to this bill.
Representative Freeman, you're recognized.
Thank you. And I know I'm out of order, but as I came into the committee, I was trying to prepare for the bill and didn't have an opportunity to recognize some of my constituents in the audience here with Moms Demand Action and Voices for a Safer Tennessee. And thanks to everyone out there wearing red today, advocating for gun safety reform.
Thank you. Chairman Terry, you're recognized.
Thank you. And wanted to bring up a point that I think was brought up earlier in this discussion and about physician shortage. And right now, I think the last estimate was we're maybe short 300 psychiatrists in the state. And there is a looming physician shortage. And I've seen numbers 40,000 to up to 100,000 by 2035. And a lot of that has to do with, obviously, the cost of going to medical school, setting up a practice. But then, if you're getting reimbursed at rates, if your overhead is 65 cents on the dollar, but your reimbursement is, 25 cents on the dollar, you're underwater. And while I think this will help us with that, there's other things we're going to have to do because we have issues. Obviously, the nation has issues from the mental health issues related to COVID and learning loss and all that. It's only going to be exacerbated if we don't start taking steps now. So I applaud you for bringing this, and I look forward to supporting it.
Thank you. I agree with that in the sense that independent practitioners of mental health services are at a disadvantage because they don't have the strength to negotiate strong rates. And I think this tries to level the playing field for them. Representative Ritchie, did you want to be recognized again? Okay. Members, anybody else? Chairman Sparks, you're recognized.
Thank you, Chairman Williams, for the legislation, and thank you to Senator Reeves for sponsoring it. How much would this help us relieve our overcrowded ERs?
Chairman Williams.
In the short term, I'm not sure it would help us relieve our overcrowded ERs. I mean, that's one of the questions that we had at the end of last year as it relates to care. I mean, there's a severe bed shortage just because you have a reimbursement rate that allows people to make money. There still has to be room at the end. So there's more to work to be done in this space as it relates to those cares. But Where it does really, where it will have its greatest impact are those 24-hour, 72-hour facilities that we have that are usually privately owned across the state, where these people will be able to get the services they need there. But I think we'll still have to look at how we do long-term care, inpatient care for mental health. I know the speakers visited West Tennessee and in Moccasin Bend and Chattanooga, and there are current facilities there that could be expanded if we made those beds available that are already exist in the state. As our knowledge and understanding of mental health treatment and services continues to modify or change over time, my suspicion is that this body will be faced with the idea of opening more of those beds in the coming future.
Yes. I was at a meeting at St. Thomas Ascension with it's a group called We Care, and they help with addiction and alcohol treatment. And I asked if we've reached an epidemic, and everyone's agreed. We were at a meeting at Trust Point here recently, a few weeks ago. They all agreed. But here's what disappoints me is what I call the silos. I don't see a lot of the communication. I know you and the speaker and Dr. Terry and others have tried to engage with that discussion, but I've kind of seen this stuff personally. I've got a sister in a nursing home that lost everything to her name, everything. She's on TennCare. And I remember the director, they've had quite a bit of turnover with labor over there. And he told me, he said, technically we lose, I forgot how much it is a month on my sister. And I thought, wow, she lost everything to her name and on TennCare. And so I've often thought, what would happen if this facility closed? Where would my sister go? Where would these folks go? The labor shortage, some of this needs to be addressed. I think we need to be as diligent and as aggressive on this issue as we can. I'll be honest with you, I'm the tightest lawmaker up here. I'm the most frugal lawmaker up here. But I see this as an investment in mental health, invest in the future. Another thing, Chairman, Tennessee is one of the most violent states in the nation. If you look, some of this is mental health, some of this is drug addiction. I guess I'll be the first to cite that statistic. I'm embarrassed to say it, but we're one of the top 5. I just want to challenge this committee to have this discussion more often, challenge these chairmen who are smart fellows up here and ladies to engage on this, because I don't want to see in 2 and 5 years where this problem gets worse. I'm afraid it's going to get worse, but thank you for your legislation. I'm going to vote for it.
Thank you, Chairman Sparks, for reminding us of the needs of our community. And on frugality, you are in good company. Representative Davis, you're recognized.
Thank you, Mr. Chairman. And to the sponsor, I just wanted to, I also serve on criminal justice. And one of the things that we've talked about in various legislations is that we're wanting to ensure that more people have mental health evaluations on the front end before they're brought in and put into that criminal justice system. So would your bill impact that and have more people available to really meet that capacity or that need of having those evaluations?
Chairman Williams.
Well, thank you. I wouldn't venture to guess as it relates to whether it did, but I would say that the byproduct of having more counselors and mental health treatment in our communities would benefit our those who are seeking or who find themselves facing jail in our state. When I talk to the providers in my community, it's pretty amazing to me how most of these people are still in this space because they feel called to it. They're not doing it for the money because quite frankly, it just does not pay well at all. And so I think we've done so much with so little for so long. It's pretty amazing. And so hopefully with a bill like this, that we can try to get those people some relief really by bringing on other people that provide those services too.
Representative Davis, sure. Okay.
Thank you, sponsor. In my opinion, I believe it would, because if you're being reimbursed at a rate to where you, like you said, you can keep your doors open, that makes those facilities, those beds available so that we can try to treat those folks and keep them out of that spiral of falling into the criminal justice system. So I appreciate that. Thank you, sir.
Any other questions, members? Question's been called without objection. We are voting on House Bill 7032. All those in favor, please say aye. Aye. Opposed? The bill moves on to the Finance Committee.
Thank you, Chairman and
Chairman
members.
Williams. Members, any other order business to bring before the committee? Seeing none, and this being the sole bill on our calendar for this session, the committee will close, but be open to the call of the chair. Thank you. Have a good day.